22 people believed to have been in close contact with the 27-year-old Kenyan woman who tested positive for the coronavirus have been quarantined in the infectious disease isolation unit at Mbagathi hospital as results of samples taken from them are awaited. Well, Health Chief Administrative Secretary Dr. Mwangangi revealing that 23 other passengers of different nationalities who flew with the patient have been traced and advised to self-quarantine. As Chemutai Goin reports, Kenyans have been warned against sharing false information on social media.
After a 27-year-old Kenyan tested positive for the coronavirus, health officials literally burnt the midnight oil as they worked to trace all who had close contact with her so as to contain the spread of the deadly virus. Today,
the Ministry of Health has traced 22 close contacts who have been quarantined at KNH isolation units at Mbagathi. Specimens from these contacts are currently undergoing testing at KEMRI laboratories.
23 other individuals of mixed nationalities who are aboard the same aircraft to the coronavirus patient have also been contacted and advised to self-quarantine for the next 14 days. So far, 17 tests conducted locally since the outbreak of the pandemic have returned negative results. The government confident of the measures it has put in place, saying they had learned valuable lessons from countries that were first hit by the pandemic.
Our preparedness is at the highest level possible. However, we cannot get to 100% preparedness if we do not involve the local people. And therefore, to get there, every Kenyan must be involved in as far as prevention is concerned.
At MOH Kenya, and at spokesperson GOK were listed as the only valid social media channels that would be used to disseminate information.
The fake and alarming videos have been forwarded to the DCI for investigations, arrest and prosecution of such individuals.
Members of the public seeking information on COVID-19 can reach the call center by dialing 719 for audio messages and *719# for short messages.
Anyone showing symptoms of chest infection illness, such as fever, coughing, difficulty in breathing, sneezing, and with a history of travel, is strongly advised to go to the nearest health facility for assessment and prompt management.
Directives on how public transport will be handled will be issued Monday next week. This after it emerged the patient had boarded a bus to her Ongata home. The bus has since been fumigated. As the government continues to assure members of the public that it has put in place the necessary measures to contain the spread of the deadly virus, it is warning those members of the public against sharing false information that is likely to cause panic. Chemutai Goin, Citizen TV, at the Kenyatta National Hospital, Nairobi.